Can you hear me? Yeah? Okay, good. Should we go ahead and start, or did you want to say anything, or no? All right, great. Well, for those of you that don't know me, my name is Paul Grossfeld, and I just want to thank all the people that have made this conference so amazing over the years. My first conference was the first conference of this group back in 1998, and I've been to almost every one except 1 year for Thanksgiving I didn't come because of the American holiday. And I just want to say to all of you how just fortunate I feel to be here. It's just such a joy. So in this talk, I'm just going to share with you sort of my personal experiences with Jacobsen syndrome. Forgive me, I'm still a bit jet lagged, so if I say something stupid, raise your hand. Actually, if you have anything at any time you want to ask or add, please do raise your hand and feel free. Okay? All right, so does this come out, or am I stuck here with it? There, okay, now I can pretend to be a rock star. All right, so moving forward here. Yep, so I don't have a child with Jacobsen syndrome. So one might ask, how did I get involved? And from my background as a pediatric cardiologist, besides seeing patients in the clinical setting, I've always had an interest in doing research to understand how these heart defects occur. And in particular, there's one that I've been most interested in called hypoplastic left heart syndrome. And that is, to this day, one of the most severe congenital heart defects. And it's actually the most common cause of death in all babies born with any heart defect. And it's one of the most common causes of death in babies, maybe the most common cause of death in babies with Jacobsen syndrome too. And my hope was, like any disease, if we can understand the mechanisms underlying the disease, we can treat it better. And maybe someday develop some ways to prevent. So, like I said, I'm going to give you a little bit of history, but also share with you my very personal experiences. And let me apologize, I probably will overlook saying some things that are very important, so accept my apologies. For those of you that have not seen this, this was Dr. Jacobsen's first paper published in 1973. And this was the first patient that she had described back in 1973. And I believe this gentleman, I think, is still doing well. I haven't heard recently. This picture is from many years ago, but he's now must be close to 70 years old, living in a group home. Okay, so when I was in my first month of cardiology training in San Diego, that's when I came across my first patient with Jacobsen syndrome. And he had exactly the kind of heart defect that I talked to you before about, hypoplastic left heart. And in his hospital chart, which was all paper back then, there was actually a copy of Dr. Jacobsen's paper describing his syndrome. And that was immediately very interesting to me for my research, because it suggested, here is my heart defect that I'm most interested in due to a specific cause, genetic cause. And I'll spend a lot of time on Saturday giving more details, a lot of details about the heart research. But one thing that over this next few years became apparent is that Jacobsen syndrome has maybe the highest frequency of hypoplastic left heart syndrome of any known genetic disorder. So my hope back in 1997 and still today is what we can learn about hypoplastic left heart syndrome and Jacobsen syndrome can apply to the much broader population of patients as well. So this is the little boy, Edgar, taken back in 1995. And he is really why I'm here today. Because without his family's willingness to support and cooperate with our research, I never could have started. And I had been taking care of Edgar for many, many years until about 3 years ago when he kind of aged out of the pediatric healthcare system in the United States. And I learned very sadly back in October that Edgar passed away. And this is a picture of the last time I saw Edgar. That was about 4 years ago, I think. And maybe in a little less formal setting, we can talk about how that happened. And I will say that, at least in the United States, it is a very, very big challenge when your child becomes an adult and transitions into the adult healthcare system. And like so many things in the United States these days, we can do a whole lot better. And I'm not going to talk about politics. Suffice it to say. So it was a little later on, after that first encounter, that I began my research on Jacobsen syndrome. And I think this slide perfectly captures to this day what it's been like, an odyssey. So any long series of wanderings, especially filled with notable experiences, hardships, etc. That's a good way to describe it. So when you work with families, there are a lot of challenges. It's a little different than if you just work with mice, right? So there had been kind of someone before me, coincidentally also in San Diego, who said he was doing research on Jacobsen syndrome. But as we say in the United States, he was just a lot of hot air. And sadly, because of that, but understandably, there was a lot of mistrust by the families back then of people like myself doing research. So maybe even to this day, I have to make sure that I earn the trust of all of you and all the families that I've worked with over the years. So I think, like Gisa said, I attended starting the first conference back in the spring of 1998 in Holland. And I'm going to guess some of you may recognize this lady, Annette. I won't try to pronounce her last name. I see. Can you pronounce it for me, please? Yeah. Perfect. And it also gave me the chance to meet some of the first families from your group, from the European group. And in that same trip coming back, I made a stop in Virginia to meet the first American group president, Melanie Johnson. So both groups actually formed within about a year of each other, coincidentally. So what became apparent to me when I was meeting families is they had a lot of concerns, not just about the heart. And so I kind of had to accept that I would try to help them, even though this was not my area of expertise. So it did kind of take me out of my comfort zone. But I think you'll see we've come a long ways. So the spring of 1998, I spent 3 months in London with this researcher, Dr. Chris Jones, that maybe some of the older families remember. Chris was the only PhD researcher that I knew of that was studying Jacobsen syndrome as a scientist. And he was very interested in learning how or what causes the deletion. So I spent 3 months in his lab in London, 7 days a week, learning some of the human genetics approaches that I could hopefully take back to start doing work on in the United States. And Chris is an amazingly talented scientist. And sadly, because of lack of funding, he turned to developing a beer. We'll save that story for a beer tonight. How's that sound? And I'm sure many of you know Teresa Mattina, who I also met at that first conference from Italy. She's spoken before at these conferences many times and in the United States. And Teresa is an incredible clinical geneticist who, as far as I know, besides me, is the only other physician in the world studying Jacobsen syndrome full-time. And as part of her program, she has trained a number of graduate students to earn a PhD studying Jacobsen syndrome. And Ketty, who I think came here for one conference a long time ago, was her first student. And how many of you have heard the term Paris trousseau? How many of you know where that name comes from? Here's a hint. So Remy Favier was at the time, I think he's retired now, studying the bleeding problem in Jacobsen syndrome. And he's located in Paris, and the name of his hospital is the Trousseau Hospital. So now you know how Paris Trousseau came about. And I know that we'll be having a formal talk tomorrow, maybe, on Paris Trousseau. And one of the other challenges, which in some ways is more than the heart issues, are the cognitive and behavioral problems. And I was able many years ago to connect with 2 PhD psychologists in San Diego. And over a period of several conferences in San Diego, they did assessments to learn more. And I'm sure most of you have, get closer to the screen. You don't want to see me, you want to see the screen.
They're walking out of frame.
Oh, okay. All right, it's just easier for me to read my own thing. That's okay. So this is Ken Paris and Virgil Dahm. Ken is in New Orleans and Virgil is in Holland. And their work, unfortunately, neither could come to this conference, but their work has literally led to life-saving interventions to prevent what can be sometimes fatal infections in people with Jacobsen syndrome. And kind of going back, another challenge which we realized was so beneficial was having conferences like this. And just like the European group, the American group has pretty much had every 2 years a conference. And most of them have been in San Diego, because that's where my team of colleagues have been. But we also appreciated that families in other parts of the country would like to have one closer to their home. So we've had one in Florida a while back. And then after COVID in Washington, D.C. And then 2 years ago back in San Diego. And then this summer, July 11th through the 13th, in Indianapolis. And I will take this opportunity to invite all of you on behalf of the American group, if you're ever interested, to come attend this conference. They're both great conferences and have actually become pretty similar the way they've evolved. And for me, especially earlier on, but even true now, I have learned so much about this syndrome just by talking to so many families like you. And I can truly say that for me and my wife Susan and our son Stefan, we have had so many wonderful friendships over the years. It's really touching. And before I forget, Lindsay Carroll, and Jessica Ficchetti, the President and Vice President, send you their love and best wishes. Had to get that one in. And this is where we had the first conference in San Diego, right, looking down on the ocean. And we wanted it to not be just for children with deletions, but thanks mostly to Dr. Matina, like for Annette's daughter, to include talks talking about duplications of chromosome 11. And we had about 35 families at that first conference from all over the United States. And that knowledge led to our publishing our first paper on Jacobsen syndrome back in 2004. Involving about 110 people with Jacobsen syndrome. And prior to that, the largest group was, I think, 17. So this was really a huge step forward. And as I said, even since then, we continue to learn. I continue to learn, just mostly by talking to families and social media, for better or worse. So before I continue, does anybody have any questions, comments, anything anybody want to add? All right. And I can't believe it's been 10 years since you've come on. Suffice it to say that wonderful people like Gisa and Lindsay are why these groups and these conferences are so successful. They are just amazing people. Thank you. How about a hand? And their spouses behind the scenes. All right, challenge number 4. What have been the major medical issues? I've kind of alluded to those. So historically, bleeding, right? Infection and congenital heart defects. And this is just one example of learning how Yuli, who had a congenital heart defect, sadly passed away from infection of her heart. So she kind of had 2 of those problems. And it was actually at a conference back in 2012 when we were just sort of doing an informal survey to the group, like you, about infections. And what was amazing is that almost every family described multiple infections occurring in their child, which was really very suggestive that there was more to it than just an occasional cold. And it turned out that we think now most children with Jacobsen syndrome have varying forms or degrees of severity of immunodeficiency, and that's really, really important to know. We'll be hearing more, I think, about immunodeficiency, but it has led to a protocol that we have made available that I'm sure most of you are aware of. Something else that I didn't really quite appreciate until suddenly there was almost like an epidemic of children suffering brain hemorrhages. And this is really thanks to Nigel Barrett, who had worked with this group, the European group, who told me about what ended up being about 6 cases of brain hemorrhages, catastrophic brain hemorrhages. And that's what led to this paper that we published a while back, including recommending that everyone at some point with Jacobsen syndrome should have a brain scan to make sure that they don't have a risk of a brain hemorrhage. COVID was another big challenge, as you can imagine. Imagine the idea of someone who's immunodeficient being exposed to this virus. And we kind of evolved our thinking and fortunately found that most of your children could still make an antibody to the vaccine. And once we knew that, that was huge because then that meant their children could go back to school with the rest of the children once there was clearance. Another aspect is how do we manage children with this very severe heart defect that I study? One of the reasons why I wanted to publish this paper is that I had received emails from families around the world that had a baby with hypoplastic left heart syndrome and Jacobsen syndrome. And they were told that their surgeons refused to operate on them because of the other problems that go along with Jacobsen syndrome. And yes, we know that children like this baby who is born with hypoplastic left heart syndrome are at risk for bleeding and infections and seizures. But all of those are manageable, usually, if you know about it ahead of time. And so I felt this paper was very important because it showed to the medical community that one can have Jacobsen syndrome with hypoplastic left heart syndrome and go through the surgeries that any other child would go through. Okay, we formally created what we call these medical protocols, thanks to an attorney friend of mine, Chuck Haymeyer. And basically, a medical protocol is a written document that states the medical problem and the treatments. In this case, bleeding and immunodeficiency. And if you hand that to your child's treating doctor, in the United States at least, they are medically obligated to follow that protocol. And most doctors actually appreciate that because most doctors don't know about Jacobsen syndrome, and this actually makes their job easier. And these protocols are available on at least the US 11Q website. Is it on? Yeah. In multiple languages, correct? Great. So nowadays that we have a much better handle on preventing bleeding complications and preventing life-threatening infections, the most common cause of death we think is now mostly from cardiac and specifically hypoplastic left heart. Okay, so my approach has been the genetics part of it to find the gene or genes, and I'll talk a lot more about that on Saturday. But there have been some really important milestones along the way because when I first started in 1998 or 97, we didn't have these technologies. all I could say is there's this chunk of chromosome 11 missing, and there must be a gene in there somewhere. But it was thanks to technologies like this that you're probably familiar with, especially those with younger children, called microarray. We could pinpoint the deletion breakpoint down to individual genes. The other thing that I should have made a slide for is about the same time, the first version of the human genome sequence was published. And that combination allowed me to know for any of your children, I can give you a readout of exactly which genes are affected. And from that, I can give you some way to predict the potential problems that you might be experiencing. And at least in that way, you can get early intervention and be best prepared. Just to give you a little history, this is a little girl who is from Colorado, my home state, who was born with hypoplastic left heart syndrome and Jacobsen syndrome. And this really advanced our research because we always thought, based on small numbers, that we only see hypoplastic left heart syndrome in the children with the big deletion, but her deletion was about half that size, and she still had hypoplastic left heart. So that narrowed the region maybe from about 150 genes to maybe about 75 genes. So that was a huge step forward. She ended up getting a heart transplant as an option and did very well until, sadly, she died at about age 10 from complications from the transplant. These are two siblings from the UK with Jacobsen syndrome. You can kind of tell that the little girl has that kind of blue, dusky appearance. The boy is pretty normal color. So two very different heart defects, it turns out, these children have from the same exact deletion. And we had no idea why, but we found that very interesting, and our most recent research, I think, helps us to explain that. And this is a little baby from New York with kind of a version of Jacobsen syndrome and hypoplastic left heart syndrome. And she had a very unusual type of chromosome arrangement on 11. And I think maybe you'll see this. Let's see here. Where's my pointer? Okay, this is a normal chromosome 11. That red dot marks chromosome 11, the middle, and these red dots mark the end. And her other chromosome 11 has the middle and the end, but if you can see this, there's also a little region there that's red. I won't go into the details, but that helped us to pinpoint what we thought was exactly the gene, or a gene, that can cause heart defects in Jacobsen syndrome. And from that, we identified this gene called ETS1, which again, I'll spend a whole lot of time talking about on Saturday. But in mouse models, we found that if we just specifically delete that gene, we get some of the same heart defects your children have. So that was a big accomplishment if you put into perspective. From about 1998 to 2009, that's how long it took to identify this gene. If we were starting today with all the technologies we have now, if I had those same patients, we could probably do that in a month. And another interesting aspect was we could actually use some of these very exciting technologies with stem cells to create stem cells from Jacobsen syndrome patients and reprogram them to be, let's say, heart cells. And by reprogramming heart cells from a patient like this little boy with Jacobsen syndrome, in the test tube, we could do experiments to understand what the mechanism was of the heart defect. And again, you'll hear more about that on Saturday. And that led us to publishing a more recent paper in 2022 that talks about one population of cells in the developing heart that are affected in Jacobsen syndrome due to the loss of ETS1. And knocking out or eliminating ETS1 in that population of cells causes one group of heart defects that some of your children have. Including what some people will refer to as a hole in the heart. And then back in 2022, we also published another paper showing how if we eliminate that same gene in a different population of cells, we get a different type of heart defect. And this population of cells is called the endothelial cells, which are cells that are part of blood vessels and part of the inner lining of the heart. And it turns out these cells have some very, very important functions that we've discovered for allowing a heart to develop normally. And this is our most recent paper, which actually just came out in February, 2 months ago, where Lu Wang, who is a superstar in my lab, showed that these cells are actually secreting growth factors that are required for the heart to develop normally. And I'll talk more about that on Saturday. And what was really exciting is in this issue of the journal that just came out in February, as a way of acknowledging the importance of this last paper of ours, there was an accompanying editorial written by other researchers that had no role with our study that pointed out what a great accomplishment this was for our research and the field. And I think you can see how gratifying this is to me, that here we started out with Edgert, 1 in 50,000 births, and now we're publishing papers that have much broader application and not just in Jacobsen syndrome. All right, so I think almost all of you can appreciate this challenge. Maybe I should have made this challenge number 1 for priority. And that is to try to understand more about the behavioral and cognitive problems. And as I mentioned, I was able at the time to bring in 2 PhD psychologists in San Diego that have led to identification of what the problems are and what some of the causal genes are. And at least for one of those genes, it raised the very interesting possibility of a specific drug that could be used, maybe to treat at least some of the most severe forms of behavioral problems. And this is the Olney family. I don't know if any of you have met or remember the Olneys. They've kind of gone back and forth. They were in Europe, but I think they're back in Canada now. So Robin was at one of these conferences, I guess in 2004. And until then, I always felt like children with Jacobsen syndrome are very, very social, in your face, don't respect boundaries, which is true to some extent. But what Robin was found is actually to have part of many of the features that are classic for autism. And that really came as almost a shock to me, because I think of autism as exactly the opposite of being very socially interactive, but that was probably my ignorance. So these are some of the papers that we've published since then. This was our first paper showing that we could find genes that correlate with specific cognitive or behavioral problems. And in this case, as I mentioned, one of the genes we identified we think can cause autism. And thanks to a wonderful group of collaborators in Japan who already were studying this gene in mice, they showed that a specific medication called clonazepam could help to treat some of the symptoms that their mice have and maybe humans. But clonazepam has its own problems as a type of drug in the family called benzodiazepines. Don't worry about pronouncing that. But we think there may be a role for clonazepam, at least in some severe episodes of behavior problems. Well, unfortunately, Sarah and Natasha have both kind of gone by the wayside and retired. And so they have never published some of their most recent data. But very recently, a group from Spain published some very similar findings, which were very, very consistent with what Sarah and Natasha have identified. Pardon me? Oh, that's awesome. That's great. So they'll be here Sunday. That's awesome. We've tried clonazepam in a few patients with sort of mixed results. Unfortunately, I don't have the resources to formally study the way we should. But I would say that if a child is having a really severe behavioral kind of breakdown, that maybe clonazepam for just a few days may help to kind of bring them back down. But as I mentioned, with long-term use, there are definitely risks, including tolerance. So it's probably not a good long-term treatment. Now, interestingly, another drug has come along by accident that may help with other aspects of cognitive function, what we call daily living skills, and maybe even help with some problems with sleep. And I'm not a psychiatrist, but buspirone is quite commonly used and is quite safe from my understanding. And I'm not saying you should just throw your kid a pill and say goodbye, but in combination with other resources like counseling and therapies, buspirone, again, may be helpful for at least those children that have either a small or medium-sized deletion, we think. So if any of your children have been on buspirone, I would love to know. That's the next best way, sort of retrospectively, to learn if it may be effective. So all this research doesn't happen for nothing. The other huge challenge that I'm constantly facing is getting the funding to keep this going, including my lab, and that means paying the salary of what were 2 and now just 1 PhD researcher in my lab. And of course, all of the other reagents and housing for mice, that kind of thing. So that comes out to about $350,000 a year. And it's not easy, and it's only going to get worse with the current political situation. But having said that, I've been very, very fortunate to have a number of families, like from this group and others, step up to do fundraising events like this one. How many of you know the TV series that was on a long time ago, How I Met Your Mother? Yeah, there are a few. Anyway, Craig Thomas was the co-creator of that television show, and he and his wife, Rebecca, have a son with Jacobsen syndrome. He's about 19. In fact, he's turning 19 this month. And this is from one of the 2 fundraisers they held on the set of How I Met Your Mother with the actors. They had 2 of those when the show was running. the show has been off the air now after a 9-year run, I think for about 10 years. But still, Craig and Rebecca every year have a fundraising campaign with all their How I Met Your Mother team members. And over about the last 15 years, Craig and Rebecca single-handedly have raised for my lab close to $2 million. $2 million, which comes out to about half of that $350,000 that I was telling you about. So where does the rest of that funding come from? Well, I haven't had to rob a bank yet, but I've been close. So besides Craig and Rebecca, your group has been incredibly supportive, the American group, the 11Q Spain group at one point. And these on the bottom are just in the last year or two that I have been very blessed to receive some pretty substantial funding to make up that difference, to bring it up to about $350,000 a year. And to put this in perspective, literally about a year ago, I only had about 6 months of funding before I was told I was going to have to shut my lab down. And it's just been in this last year that these 4 groups below have literally saved my lab, in addition to what Craig and Rebecca have done. So one of the challenges that we still face is distributing all this amazing amount of information, right? So it still amazes me when I look on the Facebook chat that a family will write in and say something like, my child has a lot of bruising, easy bruising and bleeding. Has anyone else had that problem? Yes. So a couple years ago, we, on the American website, which obviously you can use any way you wish for the European group, created a frequently asked questions, primarily for new families to begin to get informed. We also have a listing of basically all of the publications dating back to 1973. And that's thanks to this young lady who I think is now a medical student, Elena, who volunteered her time to create that amazing database. There are, I think, over now 150 papers that she has put onto the website that are in English, but you can download right from the website. And this is just to give you a little bit of an idea of how many papers have been published in the last 40 or 50 years just on Jacobsen syndrome. And you can appreciate how it's really kind of grown exponentially as more awareness has been raised. And I'm happy to say that we have published from my lab about 25 papers. Number 26 is about to be submitted. And this is always the hardest part, is learning from the losses, which sometimes give us the most information. These are 3 babies, all with hypoplastic left heart syndrome and Jacobsen syndrome, that passed away just in 2023. And sadly, as I mentioned, Edgar passed away just 6 months ago. And again, I wouldn't be here today without Edgar. So I've been in touch with their family, and one of the things that we're hoping to do after we overcome some legal obstacles is to create a scholarship fund for the high school in San Diego that Edgar went to. That would, in his memory, award 1 or 2 high school seniors who want to pursue some kind of a career helping people with special needs. So I think this would be a really wonderful way to honor Edgar and his family. And of course, I'll try not to get emotional here, but it is obvious for me to say I wouldn't be here today without my parents. They both passed away back in 2014, about 8 weeks apart, but their memories will always be with us. And this is the other 2 most important people in my life, Stefan, our son, who graduated just last spring from high school and is now going to college in Los Angeles. And unfortunately, he couldn't make it to this conference because he's in class, but I can tell you from the time he was 6 months old when we took him to his first conference, he has had the opportunity to meet so many of the families. And I can tell you, just like for Susan, he is such a better person because of his opportunity to meet and understand children like yours. So it's really been a two-way street. And where would I be without my wife, who is here? I think she's asleep right now, actually, getting over her jet lag too. But I'm sure many, especially in the evenings, hopefully, if you haven't already, will get to meet her. So moving forward, there's always more to learn. Alan Alda is one of my favorite actors in the United States. He was the star of a very long-running show called MASH that some of you may have heard of. And I love this, whether it applies to research or marriage. I'll just read it in translators. Go ahead. Real listening is a willingness to let the other person change you. When I'm willing to let them change me, something happens between us that's more interesting than just a pair of dueling monologues. That holds so true, and that's why part of the time I'm here is to meet with some of you individually. And John Wooden is arguably the most successful college sports coach ever in the United States. I think he won in a row 8 national championships, 8 years in a row, something like that. And this is one of his quotes. It says, "Make each day your masterpiece." And I'll share a really cool story. When he was interviewed after winning their 8th national championship, a reporter asked him, "How do you think this team that won the 8th championship compares to the other 7 teams?" And his answer was so great. He said, "Ask me that again in 10 years, and let's see what these guys are doing besides basketball, and then I'll be able to answer your question." I love that. And I love this picture that I took at the last conference. I think, is she here today? Oh, there you are. Yeah. Sorry. Your hair's a little different. But that just captures everything. I just think it's so beautiful. And thank you. I'm done. At least until Saturday. Anybody have any questions, comments? All right, we're good. Is there a break, or do we move right into the next talk? Did I finish earlier? Short break. How many, 10 minutes? Okay, 10 minutes? 5 minutes? All right, quick break. Be right back.
One second. We do have a question from the YouTube chat.
Oh, okay.
Can you elaborate more on how buspirone improved daily life tasks?
Right. So there were 2 patients so the question is, can I elaborate more on how that drug buspirone helps daily living skills, or working memory index is another name for that. And the way I came about this, sort of by coincidence, was I learned about 2 children with Jacobsen syndrome that had been started on buspirone for other reasons, actually. And both of those children underwent comprehensive cognitive evaluations by my team. And while most of the cognitive functions were not really affected, each of those 2 patients did have a statistically significant improvement just in working memory index, or daily living skills. So that's my data, my evidence-based data, to suggest that buspirone may help people at least with less than a 12 megabase deletion, as it turns out, with that specific aspect of cognitive function. And the mother of one of those patients swears that once being started on buspirone, her child has had much, much better sleeping habits. So I think buspirone, if you're looking for a drug to try, knowing what its limits are, but maybe of some benefit. I hope that answers the question. The ideal would be to do a big trial and, with controls and all that, but we don't have enough patients and we don't have enough money. So any other questions from the YouTube? Nope. Okay.
Let me test. Yes. So thanks for your first talk, Paul. The next talk will start at 4:30. So we have just over half an hour of break because we want to start all of the talks at the intended time, especially for the online viewers.